I see some stuck shoulders right away.
What does stuck mean? What does stuck
That's
mean?
my term.
I love
They're
it. I think a lot of people can relate. Let's just
they're
pinpoint what's
they're
stuck.
they're up, they're
Yeah,
rounded, and just stuck because you can
stuck.
look at the arm windows.
I agree.
Look at the
I
arm windows.
And that's how I would agree with the stuck, right? Because she's stuck, she can't actually bring her arms by her sides because she's stuck.
Yeah.
You're correct. That is called medial rotation of the humerus, which is a fancy way of saying she's stuck in the front. She's stuck in the front.
I'm going with stuck. That's the peace over pain version.
I like it.
And
Um,
so you can see the elevation too. Look at that.
yeah, it's a lot of work. It's a lot of work happening there.
She's petite. You can see she's 5 foot or under.
Yep.
And look at the rotation from the back. Her arms are just,
Yes.
you can,
And because she's petite, like people need to also remember size does matter. When you're short, everything's above you, right? I'm 5'11", so I miss this a lot. But when a short person comes to my house, they are like trying to get my dishes, right? So when you're shorter and the world's not doing that, you have to rotate a lot, look up for what you're getting for, reach with the dominant arm and pull down. Just habitually, where a tall person spends a lot of time shrinking and getting short, like at the movie theater. So, because sometimes people are like, well, how does the petite person get so stuck? Well, if she's rotating and she's carrying the load in the front of her chest because she didn't take it into her hips, but she tucked her bum thinking this will be good, I'm protecting my lower back. Because a lot of short people have to pull things to their body. And I just say that again and again and again. That's why some people who are petite are great gymnasts, because they can tumble and roll. Me, not so much. But I can get on the top shelf with one arm, pull a box and take it down and like never feel my lumbar,
yeah.
because I'm tall. So I always remind people that size matters,
So
because
you
you can
can
see she
see,
works hard in her shoulders in the front. The
yeah,
front is tight.
you can see from the side, her left arm is in front of that line, but on the right side, it is not.
Mhm.
Yeah.
And it's a tucked pelvis, so we've got a little imbalance here where the hamstrings are kind of pulling her pelvis down. She's pulling in her belly. I would say a lot of women from this time frame learned that. Tuck your tail, pull in your abdominals, then roll your shoulders back and stand up straight. But she can't do that combo anymore. So now the shoulders are just stuck.
Yeah.
Yeah, and therefore we have a rotation.
We have a potential hip rotation here too.
And a stagger. Can you see the stagger?
No.
Okay, you see how her right foot's so far in front of her left.
Right.
Mm-hmm.
Yeah.
Stagger. She's finding, let's see if all her pictures do it. It's a very suspect. Yes, she is a staggerer.
Yeah.
Let's see the other ones. Let's look to the side. I think because she's so petite, we can actually see the stagger as part of the rotation.
Right. Right.
Can you see the back of the left leg on this side? It's just peeking out.
Yeah.
But the right leg likes to go, let's see, what was her stagger? One in front of the other. So it's just a little bit of her calf on her left calf is peeking tiny bit behind her right.
Yeah.
Rotation stagger.
Okay.
So what are we going to do for this gal?
I mean, the shoulders are the main.
Absolutely agree. If this person has possible range of motion and can get down on the floor, modified floor block is going to be awesome.
And she has reported esophagus issues some years ago. So that could be obviously it could be nutritional, but it also could be posture. Absolutely.
Well, the throat is a muscle, right? We take it for granted that we've got muscles on our throat, your trachea, your esophageal, all these muscles they're move like inchworms, right? They're supposed to move your food down. And if they get squished, compressed, and if you're like, what do you mean? Think about the tribe where they put the gold rings on their neck and they stretch them, right? All they're doing to those tribe women is pushing their shoulder girdle down. They don't really lengthen their neck. Yeah. But imagine if the shoulder girdle can go up, it can also compress the throat. And then we have issues with the gluteal stop, you know, the what you do when you stop the water, like, you know, you breathe on one and you do the other, and then that whole flap starts just doing what it wants. And next we've got like all that burning and all that yuck.
Right.
So I love it. Posture, nutrition, posture. It's all one and the same. And we know that. Why do we know that? Look at all that we put into our newborn babies. Like I've seen mothers who are a train wreck, including kind of me at that time. I ate so well for 9 months, 10 months, because it was for my baby. Like, so it's really quite funny when you're like, oh, we have to nourish them. And then we get older and we stop nourishing ourselves. Like, what's up with that? Like, why do we do that? I don't
Right.
know. I don't know. Maybe we just sit down and get tired and stay there. I'm not sure. That's why I always sit up. Ooh, what have we got? Yes, sir. Look
We
at
got
that
some shoulder action. Yeah.
And then can you elevate it? So let's imagine they're there and they're stuck. Okay, right? They are stuck. Now, go find the levators and the pec muscles. The levators, the pec muscles, and the rhomboids. Beautiful. Yep. Yep. Beautiful. All right. I always feel like it's dancing for us. So all those spine muscles are in between those two shoulder blades, right, Dr. Reese? You can see that.
Yep.
Okay, lift all those guys off for a minute.
Oop.
Go back to your bare bones. You know, it's like a Superman. Okay, turn it so we get to look at the back.
Yep.
All right, again, posture muscles. I want you guys to realize posture muscles work all the time. They're supposed to work. That's their job. They're holding up your spine, okay? Your shoulders do not hold up your spine, okay? Just repeat after me. Your shoulders do not hold up your spine. Your spine gives a place for your shoulders to move around freely, right? So if this previous client we're talking about, if she's gotten stuck, everything back there is also being affected.
Yep.
And so when we say affected, well, what would that be? Is they get strained, they get stressed, and their job becomes disassociated, almost like someone who doesn't know what to do, because they're not meant to hold up the head or the shoulders. They're meant to hold up the spine. But when we dump into these postures for long periods of time, we send all these mixed messages, like a bad relationship, to these muscles. And then they all start doing the wrong job. And next thing you know, we have dis-ease or disease. And that is what it is. Your body's uncomfortable. So we want to bring back the ease into people. And a huge part is understanding that your shoulders ride around on your thoracic. So this person that we're looking at truly is stuck. I mean, we're being facetious, but they are, because the whole system is supporting the stuck. So that's why we got to treat the whole body, right? We got to treat the whole body. So the next layer goes down. Go ahead, give us a layer. Boom. Right? Now you're starting to see more spinal muscles, but again, superstructural muscles. There's some happening on the top of the scap. So we're already starting to see. Now we're getting more scap. And then there's lots of scap muscles. And the scapula, those little triangles on the back, they move around. I really think people think they're supposed to stay, you know, because we remember shoulders back, chest up. It's just an exercise. They're not supposed to stay there. But where the client before, her tips of her armpits are really where her shoulder blades have gone. Hence, you said stuck. She's stuck. So all that in the back is fatigued and not doing its job. None of it's doing its job. It's just over lengthened. It's tired. And then you can put in the rhomboids. They're going to show up. They're right up there. Like if you, yep. So, yep. Look at, and we've got all, and then we've also got, gosh, rotator cuff, right? We've got a rotator cuff. Now, the rotator cuff can't do its job if the shoulder blades can't find their home. Look at all these bloody muscles.
Mm-hmm.
So when people are like, oh my God, can you fix my shoulder? I'm like, want people to understand there's layers to this. And yes, we cannot fix, but we can rehabilitate and help you with posture with the goal and the belief that the body, when left alone and in harmony, can do amazing things. Because look at all these muscles. And I love that because you brought one day a wrestler who had a major trauma on the pec.
Mm-hmm.
But all these muscles you're showing us right here, that athlete was a primo athlete. So he was able to compensate, utilizing the ability to call upon his body to service him and finish whatever that crazy thing is that they do, and that whatever they're doing, right, is the wrestling,
Mm-hmm.
but everything's connected. Everything is connected. Look at the neck. It's in the front. It's in the back. It's in the face. TMJ, headaches. My gosh.
Mm-hmm.
Mm-hmm. And people should just know that. Like, it's not one muscle. It's not like, oh, I have a knot right here. If you have a knot somewhere, it's where like 27 different muscles have all gathered near the water cooler to talk about your posture. Like, they're
Right.
just sitting there going, I don't know. You think she's going to fix us today? Nah. They're
Right.
kibitzing. They're just there. They're like, haha. It's like those mucus commercials
They're
back in the
kvetching.
day. Yes.
They're kvetching.
They're kvetching. They just want to sit around and talk about it. But look at this structure. Okay, clavicles. Let's talk about clavicles. Let's go do it. See those bones right across the front?
Mm-hmm.
Go down there. Boom. Clavicle. All right, guys. People, humans, sentient beings. You see the sternoclavicular joint? You find it?
Mm-hmm.
It's right where it says rotate. Yep. See that little joint right underneath it?
Mm-hmm.
Go back. Now you flipped us. Go back. That right there. That's it. That is the only bony attachment of your arm to your body, ladies and gentlemen. That's it. Which is why when you break your collarbone, your whole arm kind of slides off your body. But if you touch that joint with your finger, and now I want you to lift your arm, and I want you to tell me, did that bone rotate? Did you allow it to rotate? No, you got to come up through the front, Kevin. You got to come up through the front like you're going to change. Yep. And as you're going, do you feel it rolling, or is it stuck? Because if it's stuck, that is where we see our problem, in the sense of where could it be stuck? That is the only joint. Yeah. It's an amazing concept, like, really. And when we used to, hang out and climb trees and pick apples and, like, more pre-industrial, this was never an issue for bipedal people. It's really when we've become civilized that has got, I'm really having too much fun with this, stuck. But all of that system can't do its job anymore. It's stuck.
Right.
And then that creates all sorts of issues with the head and the neck, like you said, maybe the throat, the heart, the back pain, everything. Like, this is supposed to move when you breathe, right? When you go, your whole backside, when someone says breathe in your back, right? That moves, unless you're stuck. Too much. I just want people to have hope that they don't need to stay stuck, right? Some of it is the concept in your brain too, because I've had people be like, no, my mom looks like this, my dad looks like this, we all look like this. Well, that's because y'all modeled each other. Yeah. Let's get everybody unstuck, right? So if you want your kids to grow up with great posture, either give them some protocol or put it in your own body, because
this is what we want right here.
This is what we want.
Ready function, straight line. Yeah.
And if, guys out there, you're like, this is hard. How come it's so hard? Because you're imbalanced. And that's really why we're here to help you. And I don't know, when my plumbing's off, I call a plumber, right? Like, I don't know how to fix plumbing. This I know how to help you with. I don't know anything about plumbing. I just know what happens to the plumber's body from his job. So form and function, that's always what we're looking for. Form, function, diet, nutrition, inside, outside support. And today's lesson is, where's your head? Because when it's here, you're going to get stuck.
All right. Well, let's help this woman now.
I would love that.